You know, a lot of my patient population that I see are Middle Eastern women especially. And Dr. Khan and I from Nova Clinic have been speaking for a while and finally said, why don't you come out and see patients here? Because I'm very busy in California. I have medical practice, my skincare line, filming Botched, children. But every 3 or 4 months I want to start coming out here, and I'm out here now and actually seeing patients today, operating tomorrow, and hopefully going to make this a regular thing. And I think coming to Dubai, you have all the GCC countries and the rest of the Middle East. It's hop, skip, and a jump, so it's easy to come to see me. You know, I'm not seeing a huge difference anymore between Western women and Middle Eastern women. The Arab ladies that come in, especially with social media, especially the younger generation, want to look good. They want to look healthy. They want to look rejuvenated. Yes, a little bit more plump, especially with the lips. But for example, a primary thing that, actually there is a difference. With the Arab women, a lot of the Middle Eastern women have a little bit of more of a generous nose. There's a little bit of a hump, and the tip is a little bit wider. And what I'm seeing now is the Middle Eastern women are coming in saying, I do want a new nose, but I don't want it to look fake. I want to keep it looking natural. Now that's different compared to 10 years ago. They wanted to have an unnatural looking nose. Now things are becoming more realistic, more natural, and basically how can I stay looking beautiful? Because the Middle Eastern skin, already has a darker pigmentation to it, so it usually has less wrinkles. And so basically, how could I stay looking beautiful? I mean, Middle Eastern skin is beautiful. I mean, our Middle Eastern women are beautiful. And they age a lot less than really white skin. Yeah, I think as time goes on, there'll be new ways to help with wrinkles, new technology rather than using a needle. There might be new ways to add volume to the face, again, without using a needle. And there's already great technology, but it's only getting better to help lift up and tighten skin, reduce fat, especially, I think something that maybe eventually come, but not there yet, is help reduce visceral fat. Visceral fat is the fat around the organs, around the liver and the stomach. I think there'll be new ways to take care of that also. So as technology continues, I think that patients will have to go under the knife a lot less or have less needles injected. Well, if you watch Botch, you're going to see all the crazy requests that we get from patients, and whether basically they want to. We've had patients that want to come and look like aliens, and they want us to change their ears and make them sharp, or make their their chin pointy, or take their eyebrows and elevate them so that they're way up here in the middle of the forehead. We have crazy things like that, and that's called body modifications, or they want to look like cartoon characters. And that's very, very common that we see these patients. Now, do we operate on them? No, we don't. We basically say, stop while you're ahead before you get yourself in trouble. You know, in the past, a lot of patients would really be excited about what celebrities look like and how they keep looking young, but now it's not like that anymore. Now what they do, they take their phone and they do a selfie and they modify it themselves with the filter, and that's what motivates them of doing that. Not a celebrity anymore. It's filtering themselves, and that's what's happening. So selfies and social media is becoming the mainstay of what people get motivated by, not celebrities. Well, being Middle Eastern myself, I feel that, the Middle Eastern people are beautiful. Their skin is fantastic and very healthy. And that if you really decide you want to do something, I'm always going to urge our lovely patients to do the research, find the right doctor that's a specialist in that one procedure. And if they're going to do it that they look good and rejuvenated, but not different. That's my big advice of don't look different, just look better.